From neck pain, headaches, migraines, one of the things you want to think about is getting some shockwave therapy. And here is a picture of the skeleton from the back, and everything in the red box is a target area. It doesn't mean that this entire area needs to be treated, but it needs to be checked because there's muscles that attach all the way. So this is your suboccipital area. So for migraines and headaches and nausea, this is C1 up here, this is C2, but look how far down some of these muscles travel. Then you have splenius muscle here from the lower cervical or from the lower thoracic area all the way to the upper cervical area. We have levator, which is on the corner of the shoulder blade, going all the way up to the upper cervical area here. This is a huge contributor to problems. In the lower rhomboid area, so anything that attaches to the shoulder blade here can affect what happens in the neck. And even in the front of your neck from the SCM, which you can see here highlighted, attaches to the base of the skull. And so these are some of the instruments that that people need. If you're a physician, this is what you need to do to treat. But again, this is working. This is a radial unit working on the cervical spine itself. Obviously, some of the areas as well. This area here is a suboccipital. This is a rubber tip called the atlas. This is how we would treat the upper cervical or the suboccipital area. This area, again, is the atlas tip right here. And this area is where the SCM attaches to from the front of the neck. And again, this is C1, so the atlas is actually named after the C1 device. This is a spinal tip. So it's becoming very comprehensive treatment. And then the second piece of equipment is the focus unit. And this is it just hovering over the neck. And this is me doing a treatment here. But this beam of energy that comes out is a very narrow beam. And so it's a very critical part. The last piece of the puzzle here is the EMTT on the neck area here. So this piece of machinery here is called the radial unit from Storz Medical. This is the focus unit from Storz Medical. This last one here is the EMTT from Storz Medical. To get a treatment, you need all the components. So make sure that if you're getting treatment done at a clinic, they have all of this equipment and they do a comprehensive assessment and treatment of your cervical spine. That's the only way you're going to have success.